Well, good afternoon to everybody. I'm Dr. Christine Salter, based out of St. Louis, and my practice is the Center for Vibrant Health and Wellness, where we practice medicine that is proactive, personalized, and precise, and we restore health at the cellular level. Why is that? Because healthy cells make healthy tissues, and healthy tissues make healthy organs, and organ systems become who we are: brain, heart, spleen, lungs, liver, kidneys. So when it really boils down to it, we want to have healthy cells. And so that's our practice. We have wonderful staff members. I'm board certified in family medicine. I'm also a chiropractic physician here in the United States, and I trained as an osteopath and a naturopath in the United Kingdom. That is where I'm originally from England, from Nottingham in the Midlands, and now the US is my home. And this afternoon, we're talking about the immune system and also about the benefits of fasting. Now, when most people hear about fasting, they get scared. They think they're going to die if they don't eat. But that's not true. Physiologically, we are designed to feed and to fast. A time of feeding and a time of fasting. And then when so we can look at that in a short time. The shortest time would be 4 hours. And what is that 4 hours? That's what we call the interdigestive phase. So let's say that you ate breakfast at 8 o'clock this morning. When should you eat again? Well, it ought to be around about 4 or 5 hours later. That allows the body to go through the interdigestive phase, digest the food, get it broken down, get it assimilated, the nutrients in, and what's not needed to pass on through, all the way through the gastrointestinal system, from the mouth to the anus, right on through and out. So you only want to keep what you need and let what you don't need go through. But you have to have a time, that those 4 hours, to allow digestion to occur. Let's just review what happens when we eat. So when we eat, the glucose goes up, and we get all kind of signaling that happens. Because you're in the feeding phase, the body is going to give the signal that the insulin goes up. Well, the insulin goes up after the glucose. So the glucose goes up, the insulin goes up and gives the signal we need to store this food, this nutrient breakdown. Let's store this, and that's appropriate. So glucose goes up, insulin goes up, drives the glucose down, because now it's going to go into the liver. Now so it can go in for storage, and that's exactly what it's supposed to do. It may also go into the muscles to be utilized there also. It's going to go into the brain for utilization. That's normal. And then the insulin is supposed to come down and dip down again, and it takes about 4 hours for it to get to that nadir. And then it's time to eat again. Okay? And so now it's lunchtime. And the same thing happens again. So lunchtime, 4 or 5 hours later, 12 o'clock or 1 o'clock, and the same thing happens again. And then 4 to 5 hours later, the same thing happens again. So then after the last meal, which is usually maybe 5 or 6, maybe 7, when that meal is over, and that insulin goes down, it should stay down because now it's going into a fasting phase. And now you're preparing for bed. You're preparing for sleep. The body heals itself and balances hormones during sleep. It's not supposed to be digesting during sleep. That's why it's not a good idea to eat late and then go to bed, because physiologically, that's not what's supposed to be happening. Now the body wants to take the nutrients that were assimilated early on in the day. Now the body wants to use it to rebuild and, take care of cells and recycle. It cannot be in a state, it cannot be in a phase of recycling if it's in a phase of digestion. Recycling, or another name for that, is autophagy. Some people say autophagy. It's a process of the body eating up abnormal cells, useless proteins, and recycling them for new cells. Out with the old, in with the new. That's what you want. You do this all the time at home. As the clutter begins to build, what do? You start getting rid of things. And you may recycle and use something for something else. That's what the body does, but it does that in the fasting state, not in the feeding state. So when you finish dinner and go overnight while you're sleeping, growth hormone gets released, cortisol gets released, that's anti-inflammatory, testosterone, all this nice hormonal balancing. It's just a wonderful symphony of signaling that happens. That's the ideal situation. And then you have breakfast the next morning. Now, it's interesting, there was a study that was done with patients with breast cancer, and they were looking at the recurrence rates. Well, it turned out that women who didn't eat or were fasting for 13 hours from the last meal to the first meal, a minimum of 13 hours, had a significantly decreased recurrence rate. And it could be for a few things, that there was more autophagy going on, so that they were cleaning up, and if there were any more abnormal cells that came, it would get, recycled and gotten rid of. But also that insulin signal from insulin, there's something called insulin-like growth factor. And that's a hormone of growth. So in a cancering state, if that's constantly getting stimulated, well, guess what's going to happen? If there are some cancer stem cells there, they may well grow. So those women who consistently fasted overnight for at least 13 hours significantly decreased their recurrence rate. Now I guarantee that if that had been a drug, that would be $1 billion drug by now. But it's a simple lifestyle. So that's something that is normal for us. Unfortunately, in the United States and other developed countries, access to food is so easy. Access to cheap junk food is easy. And so we tend to eat all the time. So we don't get that interdigestive phase. We don't get that nice physiological decrease in the insulin in that nice wave-like pattern. Instead, this is what happens because we're told some misinformation. As soon as you get up, you better eat. Okay, so let's say you eat your breakfast at 8 o'clock. So it's 8 o'clock, you've eaten breakfast, the glucose went up. I already told you that the insulin goes up right behind so it can drive it into the appropriate tissues. Now, about 2 hours later, that insulin is on its way down. But oh, that's 10 o'clock. I need a mid-morning snack, a muffin, or whatever it is. Well, that insulin was on its way down, and now the glucose is going to go back up again, and so does the insulin. So it never gets down where it was headed to round about noon, because now it's at 10 o'clock, and then it goes back up again, and now it's lunchtime. So it goes back up. It may start to come down after the snack. It doesn't quite make it. It's back up again because it's lunchtime. Well, you have lunch, and then mid-afternoon snack, 3 o'clock, back up again, and then it's on its way down again. Then it's dinner. Eat again. And then it's going down after dinner, but oh, we've got to have that bedtime snack. It's back up again. So for the entire day, the insulin never got to go down. The body always got a signal that it needs to store the food energy. What's that signal? How does the body store food energy? What's the greatest food or nutrient? It's fat. That's the best way. That's the biggest bang for your bucks, is to store energy as fat. And that's what happens. That is primarily a cause of obesity. What is going on now is this constant barrage of food. And it's in the name of health, because it's, well, I'm eating a healthy snack. We don't need snacks. Now, if you want to eat a smaller meal, eat a large breakfast, eat a smaller lunch, then eat a small meal. And, call it a snack if you want, but it's still a meal. If you've heard about the blue zones, these are 5 areas in the world where the people there live to be 100 and beyond. They had 9 common characters. One of those characteristics, one of those, was that they didn't overeat. And part of that is that they ate their smallest meal in the evening. So it was larger meal earlier in the day and smallest meal in the evening. And they're not snacking. I know when I grew up, we ate breakfast, lunch, and dinner. Snacking wasn't part of it. You eat a good breakfast, you eat a good lunch, you eat a good dinner. If you're finished by 6, and then you don't eat again until 8 the next morning, how many hours is that? So from 6 to midnight, that's 6 hours. From midnight to 6 o'clock in the morning, that's another 6 hours, that's 12. If you ate, then 8 o'clock, that's a 14-hour intermittent fast. That's physiology. That's the design. Okay, so that's the fasting time. And then we have the feeding time. And again, during that feeding time, it shouldn't be constant feeding, because then you give them those constant signals and you never get into that interdigestive phase and start recycling. And the longer you have that fasting phase, the more you get into the recycling and into that autophagy. So something that you can do right away is to decrease your feeding time and increase your fasting time. And within that feeding time, implement the 4 hours for that interdigestive phase. Now, if you're like me, when I first came to the US, I was pretty slim, but just the lifestyle here of driving everywhere and then becoming a resident physician, I put on a lot more fat than I would like to admit to. I often say that I got as big as a house. Part of my way of dealing with that has been doing intermittent fasting. Usually we say breakfast is the best meal of the day. But if you've got extra fat, you may have to drop that breakfast. The whole goal is overall caloric deficit, that you're decreasing the overall amount of calories that are coming in, and also changing the type of calories that come in. But there are things called empty calories. Some groups will say, well, a calorie is a calorie is a calorie. But it's not just simply about the calories. What does that calorie induce? If I eat a calorie from cucumber, it's not going to spike my insulin. If I eat the same amount of calories from juice, it's going to spike my insulin. So I want you to eliminate that thought of all calories are equal. All I've got to do is just count my calories. It's how much you're eating and what you're eating. How much, what, when, and how frequent. Let's say that again. What you're eating, how much you're eating, when you're eating, and how frequent you're eating. We can make it really simple. For me, I'll just tell you my journey. What has helped me is that I try to eat the breakfast and then have lunch and do the smaller meal for the evening. It didn't work for me. And again, what works for one person may not work for the other, because I would eat the breakfast, eat the lunch, then I still have the equal, even though I wasn't eating in between lunch and breakfast and lunch and dinner, I didn't get the overall caloric decrease, because by the time I got to dinner, I was eating a regular dinner. It wasn't overeating, but it was still the regular sized dinner, regular sized lunch, regular sized breakfast. So I said, okay, this is not working. I need to eliminate an entire meal of the day. So what I decided to do, I dropped breakfast. No breakfast. My first meal, so now I don't talk about, well, because breakfast means breaking your fast. So my first meal of the day now is round about noon, depending on my schedule, or 1 o'clock. Today, because the church service, this is what happened, we had I think we ate at 2:30. So that was my first meal, was at 2:30. And my last meal yesterday was finished around about 6:30. So that was the nice long fast that I was able to do. And during that time, guess what my body's doing? Well, it has no food, but it needs energy. So where's it going to get it from? What did we just say was a great store of energy? Fat. So guess what? From yesterday when I finished dinner until I ate my first meal around about 2:30, my body says, well, I need to maintain good glucose level. I need nutrients for different things. Let me go ahead and burn up some of this fat. And that's exactly what happened today, and what's been happening for the last few months since I instituted this. I have lost over 25 pounds since doing this in a nice systematic way, in a way that's maintained. I was able to eat a nice meal today. I wasn't sitting there saying I've got to count every little calorie. I ate a nice meal. And then, 4 hours later, I may eat a second meal or not. So the intermittent fasting is safe, it's predictable, and it works. I want to refer you to go onto YouTube and look up a Dr. Jason Fung. F as in Frank, U, N as in no, G as in good. Jason Fung. He is a medical doctor out of Canada. He's actually a diabetologist. He's a diabetologist, and I think specialty in kidney disease, because kidneys are one of the things that really get impacted by diabetes. And he readily admits that the way that he was treating diabetes has been wrong. What happens? And I saw this happen myself. But of course, you know, even as physicians, you know, we get guidelines of how we're to treat patients. And I remember, you know, in the hospital, when patients would come in and their blood sugars would be high, they'd give them insulin. Of course, insulin is going to drive it down. And so then in outpatient practice, when you get the patients who you put them on the various diabetic drugs, and then what ends up is then, okay, that's not controlling things, let's give them insulin. And then you'll see the A1C, which is a marker, the hemoglobin A1C is a marker of diabetic control. And you'll see that come down, and you'd think, oh, well, yeah, that's great. That's come down. So then that ought to translate to an improvement in mortality, right? So if we do an intervention, drug, whatever it is, it ought to be that it makes a change in morbidity, which is just the disability from the disease, or the mortality, which is dying from the disease. Well, what they found out was lowering that A1C like that, it didn't change mortality, didn't help it at all. In fact, it may have made it a little worse. Well, that was an eye-opener, a huge eye-opener. So why we're still doing the same thing, continue doing the same thing? That's the definition of insanity. Doing the same thing over and over again and expecting a different outcome. Unless you believe in magic, which I don't, if you keep doing the same thing, it's not going to be a good outcome. So insulin, there's nothing wrong with insulin when it's used appropriately. If you're a type 1 diabetic, you absolutely need insulin, or else you're going to die. That's type 1 diabetic. On the other hand, a type 2 diabetic, insulin is not your friend. Trust me. I've seen it in my own patients where the endocrinologist has put them on the insulin. And guess what happens? They gain weight. And then the patient gets confused. Well, wait a second. You've been telling me all along for me to control my diabetes, etc., etc. Lose weight, exercise, all this. Now I'm on this insulin. Now I'm gaining weight. There's something wrong with that picture. There's something very wrong with that picture. Insulin is not the answer. I just told you that when you keep eating like that, breakfast snack, lunch snack, dinner snack, bedtime snack, the insulin cruises high and gives the signal of store fat, store fat. So it couldn't be right to say we're going to give a type 2 diabetic insulin. Dr. Fung talks about that, but it goes into all the science of fasting. But of course, in this short period of time today, we're not able to go to all the science of that. But certainly you can do what's physiological, and that is to allow 4 to 5 hours in between meals, to allow at least 13 hours from the last meal to breakfast, allowing time from the last meal to go into bed, because then you won't be getting all the reflux. When you're eating late at night and then going to lay down, that's a problem. You're setting yourself up for reflux and heartburn. Just a problem. Stop eating. In that interdigestive phase, that's the perfect time to drink all that fluid. Some people don't drink enough water or herbal teas because they can't find enough time to do it, because they're too busy eating the entire time. So in the interdigestive phase, the ideal thing is to drink water or herbal tea. It's a perfect time, not juice. We already said about juice. There's no fiber. It's going to spike your insulin. It's not good. You want the real food. You want the whole food, everything that comes with it, with those berries, apples. In the skin is where you find the fiber and the pectin, the soluble fiber. You want that. You don't want apple juice. And our children, do they need snacks? No, they don't need snacks. Obesity in children is a major public health problem. These obese children are going to become obese adults. We're pushing food down their throat. Eat breakfast, here's a snack. Eat lunch, here's a snack. Eat dinner, there's another snack. We need to stop that. We need to be eating real food, whole food, minimally processed food, and our children need to be eating the same way. The only people that ought to be eating frequently are the breastfed babies. They need to eat frequently. But once we've gotten past that, then we need the nice meals with the interdigestive phase, appropriate amount of calories for the age and growth. We shouldn't be growing as adults. Children are growing. We shouldn't be growing. But we are. We're an obese nation. We've got abdominal fat, otherwise known as visceral fat. When you see that big belly, if it's not a pregnant belly, we've got a problem. I'm going to say it again. When you see that big belly, and it's not a pregnant belly, there's not a baby in there, that is highly inflammatory visceral fat. Very inflammatory, bad for the heart, bad for the liver. Very often associated with fatty liver. And trust me, you don't want fatty liver. People don't realize how serious it is. That if you've got fatty liver and that's not been taken care of, that you're not making the changes to reverse that, you can go on to cirrhosis, just like somebody who drinks alcohol. It's called non-alcoholic, it's called NASH, non-alcoholic steatosis. It's a real problem. Fatty liver, visceral fat, metabolic syndrome, and it has nothing to do with your cholesterol. You could have normal levels of cholesterol and yet have this metabolic syndrome. High triglycerides, low good cholesterol, not the total cholesterol, the good cholesterol. That's the problem. It's too low. It's not that you got high total cholesterol. Too low good cholesterol. What will raise too low good cholesterol? You've heard about this. It's nothing new. It's exercise. We've got to move. We've got to move naturally. That was one of the things in the blue zones, that these centenarians that live to be 100, is that they moved naturally. They had a purpose for living. They didn't overeat. They ate a plant-based diet. They knew how to relax. Family came first. They met, once a week in a faith-based community, and they hung around with people who are also health conscious. You have to realize that the people that you hang around with, that you pretty much become like them. So it's important that we choose who we spend our time with. You've got to be true to your health principles so that you continue to implement things that will maintain your health. And that maybe you will influence those folks to do the right thing and to have a more health conscious lifestyle. Because even as we talk about the immune system, it's all about this. Because if you're eating a carbohydrate loaded diet, and we're not saying carbs are bad. No real food, whole food is bad. When you start processing it, it becomes highly processed, highly palatable. That's when we have the problem, because you can eat tons of it. Even in some of the advertising, they'll say, can you open, I think it's, I forget the name of I'll probably just say the name, one of the chips. They'll say, can you just eat one? No, you go and eat the whole bag. Because it's highly processed. It's got all kind of natural flavors, all kind of additives designed to make you keep eating. You open the bag and you wonder where the bag went. That's by design. Don't beat yourself over the head. It's by design. It's designed that way to induce you to do that. So we need to eat the real food, the whole food, in as near natural state as possible. And now with all the toxicity that's going on, we want to make sure that it's not sprayed with pesticides and herbicides and glyphosate and Roundup and all this stuff that adds another dimension to what we're eating. Because now we're talking about the toxic burden and what it does. When we eat a bunch of sugar, juices, chips, just overload the system, it slows the natural killer cells. And this is an important part of the immune system. The immune system is broken into two main parts. We'll call it the innate and the adaptive immune system. The innate system is kind of like general. It will go after kind of whatever comes its way. If it's a virus, a bacteria, some foreign object, cancer cell, yeast, it's just going to pull out the stops in a non-specific way. It's going to go and engulf and kill, produce hydrogen peroxide, kill that. But the body, we're told we're fearfully and wonderfully made, and we are. For certain of the organisms, the body says, I'm going to remember you next time. That's called the adaptive immunity. And that's when they produce the antibodies. So they produce memory cells. So when they see that same kind of antigen, and that's just a marker on the cells, it's going to come back in full force and say, I recognize you and I'm going to take care of you, right? And it goes and takes care of them. Your best defense is to have a healthy immune system. Your best defense is to have a healthy immune system. And all the things I've talked about in the context of fasting is going to help your immune system. With the intermittent fasting, we have the autophagy. It's going to clean house, make sure that it's out with the old, in with the new. We want to make sure we have good nutrients. That's why we've got to eat real food, whole food. That's going to give us the right nutrients so that you can feed the immune cells. Needs B vitamins, needs iodine, needs vitamin C. The immune system needs proper nutrients. That's what you've got to supply through your diet or by some targeted nutritional supplements. But nutritional supplements are not a substitute for proper eating. You want to eat the plants. You want it to be a plant-based diet. that's real, that you can break down and absorb nutrients. Let's give an example, an extreme example of a nutrient deficiency. So these people were dying of what looks like an infection. Gums were swollen and bleeding, sores that wouldn't heal. They were getting infections and dying. They thought it was an infectious process and was looking to see what is it. These were gentlemen who were in ships. I think you know now what I'm talking about. What I just described is scurvy. That's a deficiency of vitamin C. So nutrients make a difference. And if you have a significant deficiency, it's going to affect the immune system. It's going to affect the entire body system, just like it did in scurvy. And these people died. Well, who would have thought? Vitamin C. What's another vitamin that's important for the immune system? Vitamin D. D is in dog. Where do we get vitamin D from? For the most part, it's from sunlight exposure on the skin. Because really we are electrical beings. The body uses light, photons from the light to use an electromagnetic reaction in the skin to go on through other biochemical processes at the level of the liver and then the kidneys to produce vitamin D, which then helps the immune system, which helps the bones. Vitamin D receptors are found throughout the body because it's not just for the bones, it's also for the immune system. And that's why I'll often tell my patients at the very sign of an illness to increase their dose of vitamin D to a nice amount for about 3 days, and then get back down to their maintenance dosing. It's important that you get your levels checked because a lot of people are deficient, and especially in the setting of the SARS-CoV-2 virus and now the variants and COVID-19 and this whole thing. Vitamin D has been found to really impact the progression from a simple infection to a full-blown COVID-19 disease. When you have the infection, that's not COVID-19. You simply have the virus. And then the body will kick in its immune system to take care of it. Because when it's inhaled in, the immune system, the white blood cells in the nasal passages, in the throat, they just kick in. They make, believe it or not, they make a form of bleach. They will take the saline and it will break it down and make bleach to kill the virus. That's why it's important to do the hypertonic nasal saline rinsing, because you'll increase the saline in there, increase the bleach that the body will make. Don't put bleach in there. The body knows how to do it to kill those viruses, whether it's SARS, whether it's adenovirus, whichever virus is coming down the pike. Now we're in the flu season, so flu virus. But let me pause for a minute here and let's talk about that flu season. The flu season starts, round about late September, goes to round about late May. That's the flu season. What else happens in that season? Well, it's a time where you often find vitamin D deficiency. So one of the things you want to do right now is to make sure you have adequate levels of vitamin D. What's the other thing that happens? Well, let's have a look. September. Let's start early September. Labor Day. A lot of food, a lot of carbs, sugary stuff. Well, that's September, that's Labor Day. Well, let's get to October. What happens in October? Well, that's Halloween. That's just straight up candy, chocolates, candy all around the place. Well, that's October. November, we have Thanksgiving. More pies, sugar. So we basically have a sugar tsunami from around about September through May. So we've got Thanksgiving, then we've got Christmas, then we've got New Year's, then we've got February. So New Year's in January. February, we've got St. Patrick's Day, more stuff. Okay, so February, March. Well, no, actually, no, February is Valentine's Day. So more chocolate stuff, chocolate, sugar, more stuff. Then March is St. Patrick's, the cookies, all that. Then April is Easter, more. May, we've got Memorial Day, more stuff. And then it's around about over. As you can see, there's a sugar tsunami that happens. Lots of sugar, lots of empty carbs. So what do you think is happening to the immune system, especially if you don't have enough vitamin D on board? It's constantly in a state of being depressed. When you have a sugar load, the immune system is knocked out for about 3 hours, slowed down. So the last thing you want to do is say, I'm going to drink a bunch of juice when you're sick or coming down with something. That's the last thing you want to do. You want to hydrate. You want to hydrate because the hydration hydrates the membranes and the linings. And what do we say? That the immune system is in the lining. That's why we make mucus all the way through into the gastrointestinal system. And now we've gotten to the gastrointestinal system, I need to bring up something else that's really important for the immune system. Did you know that most of your immune system is situated in the gut? We call it the microbiome. There are more microbiota in the gut than there is of our cells. It's a whole ecology system in there, its own little ecosystem that's working together very nicely with our system, breaks down foods, breaks down fiber so the body can use it, becomes nutrients for the lining of the gut. There are different things that can mess with that microbiome. The things that we eat or not eat. If we don't eat enough fiber, you're not going to, the microbiome will not have what it needs to make things like short-chain fatty acids or butyrate. And these, the short-chain fatty acids, especially butyrate, is a huge signaling molecule in the gut. Butyrate works in conjunction with this microbiome, and I'm going to tell you, and if you can say this when you see your doctor the next time, they're going to be surprised that you even know that. They may not know it themselves. This is a probiotic or part of the microbiome bacteria. It's called Akkermansia. There's a bit of a tongue twister. Akkermansia mucinifera. Mucinifera. It helps produce mucus lining the gut to protect the lining so that things that foreign substances and bacteria and food allergens are not getting into the system, because if it does, then the body's going to react and will hyperreact. So that Akkermansia becomes very important, and only in the last few years have they found out how important it is. Because they found in chemotherapy, in a form of cancer treatment, which is called immune therapy, they found that those people who responded best or had a good response were those who had an adequate amount of that Akkermansia. So Akkermansia and butyrate, which is formed from that microbiome and is also in foods. But what kind of foods? I tell you, it's not in juices. It's in fiber. And the bacteria will break it down, produce this butyrate that helps the lining, food for the colon cells, helps the Akkermansia, and everyone's happy. But if you take antibiotics regularly and you don't restore your bacterial flora, you're going to have a problem in the gut and with the immune system. So don't ask your doctor for an antibiotic every time you get a sore throat, runny nose, fever. Antibiotics don't treat viruses. And most of the time, there is overuse of the antibiotics. But it's not just from taking it for an illness. The majority of antibiotics are found in the animal products that are raised conventionally. They load them with antibiotics because very often some of these animals are sick. And so they're pumping them with antibiotics to try and keep them somewhat healthy so that they can take them to the slaughter. It's in the food stuff. So if I want you to remember this, we don't want you getting antibiotics unnecessarily from your doctor or from urgent care. But you've got to pay attention to the animal products that you are eating. What is their source? Is it organic? Is it grass-fed? Is it free range? Is it all that? Because if it's the conventional stuff, you are getting more antibiotics than you could even imagine. And it's screwing up your microbiome. That's going to mess with your immune system. It's going to, and I have my patients do stool tests so I can see what's going on in their microbiome. You'll see all kinds of pathogens. You'll see the Akkermansia down. You'll see low butyrate. It's a messed up microbiome. So what you're eating is going to impact the microbiome. The antibiotics that you take are going to impact the microbiome. There are certain foods that will increase the Akkermansia. Like I said, the butyrate, pomegranate, cranberry, this will help. Should you be drinking a bunch of juices of this? No. Actually, the real pomegranate and the real cranberry is not that sweet. If you drink a juice and it's all nice and sweet, you know you've got trouble right there. Best to eat the pomegranate itself or the cranberries themselves, or take a supplement that's an extract of either of these or a combination. We want to get our nutrients from our diet as much as possible. So we want to eat intentionally and intelligently. Don't go by the advertisements that you see on TV, because they are just that, advertising. They make you think that you need that, and you don't. You don't need highly processed, highly palatable foods. They don't bring nutrition and they are disruptive. So your immune system needs nutrients. Your immune system needs nutrients like butyrate. And in order for it to get the butyrate, you need to have a good microbiome. So you've got to eat the right foods to have a healthy microbiome. Stress impacts the microbiome. So therefore, doing stress management is also important for the immune system. So we've talked a little bit about the microbiome. We've talked about nutrients and the intermittent fasting, so you're not constantly barraging the system with sugar that's going to slow down the immune cells. But what's another aspect of the immune system? It's the part of the circulation that you seldom hear about, and that's called the lymphatic system. So the lymphatic system has got the lymphatic organs, the lymph nodes. One of the major organs is the spleen. The liver has some of those immune cells in it, but you've got lymph nodes in your neck, you've got lymph nodes behind your sternum, you've got lymph nodes under your arm, in your groin, and then you've got this whole circulation of lymphatics. What is their goal? Their goal is to drain the overflow of toxins from all the body systems and drain it back towards the heart, dump it back into the circulation so that it can then go through the normal process of detoxification through the liver and all that. So the liver is a major organ of detoxification. But the stuff has to get there. And the lymphatics, unlike the other part of the circulation, the arteries and the veins, or the arteries in particular, they don't have a way to just simply pump back to the heart. They require muscle activity to move back. So what does that mean? That's why exercise becomes important for the immunity. If you don't exercise, you're going to have a stagnant lymphatic system, and your toxins are going to stay right where they are. It's going to be slow moving back. There are multiple reasons to exercise, only one of which is to improve your immune system by improving your lymphatics. And exercise not only improves the lymphatics from a mechanical point of view, it also improves the immune system through the signaling that happens. So simple lifestyle can be very powerful. Even something as simple as doing contrast hydrotherapy, because that impacts the lymphatics. When you do the hot shower as hot as you can take it for 3 minutes, it opens up the circulation. And then you do cold for 30 seconds, as cold as you can bear it, and it shuts things down. And then you repeat it. Open, close, open, close. Okay, you always finish with a cold. And you can go online. YouTube Pines has a nice section there on simple home remedies. But contrast, actually, hydrotherapy increases the natural killer cells. So what is something you could do if you feel you're coming down with something? You do contrast hydrotherapy. In addition to all the healthy eating or not eating, which we call intermittent fasting. Don't eat, and when you do eat, make it nice and healthy. Contrast hydrotherapy, exercise, getting the sleep. We said the body heals and restores during sleep. So it's all the things you've heard already. It's all things you've either heard through New Start, nutrition, exercise, water, sunshine. We said that for the vitamin D, important nutrients. Temperance, not overeating, fresh air. If you're breathing the same stale air, windows closed, not going out and getting the fresh air, the cell's not oxygenated. When the cell's not oxygenated as well, they don't function as well. And what I started out saying was that we restore health at the cellular level. Cells become you. If a cell is sick, you're going to be sick. If the cells don't have the oxygen, we call it hypoxia, then all the different cells, like the cells of the immune system, are sick and don't function well. So we want to do all those things. rest. We just said about rest. And then the T is trust in God. There's also another mnemonic that I like, and that I work with patients, and that's creation. Creation health. Choice. We have a choice in what we do. We make those choices all day, every day. We need to make the right choices. R is rest. E is environment. What's around you? Is your place cluttered that you can't even think straight? Are you spraying all kind of, those air fresheners that you think are so useful? Are you burning candles that are toxic? You've got to think about all these things, because all these things give us a toxic burden. And we want to minimize that. What about the stuff that you're cleaning with? Especially if you're cleaning with stuff that's toxic, you're not even open your windows. So I've covered a lot of information. It's simple, it's profound, but it's a lot. So I want to take this time now to answer any questions that you may have. And about microbiome, about intermittent fasting. And let me just say a disclaimer here. This is not personal medical information. This is for educational purposes only. All right. And that you need to talk with your physician. Don't stop any medicines or introduce anything new, because I don't know. I have no idea what you've got going on. So this is for educational purposes only. So, do we have some questions?
Well,
Just a little bit.
yeah.
There we go. There we go. All right.
Reese, if you could look at the chat for me and tell me if there are any questions. I did. Man, you shared so much stuff. I'm just like, my goodness. But there was one question in the chat that was asking, how do you eliminate abdominal fat?
One of the best ways to get rid of abdominal fat, because I had it and mine's going down, was through the intermittent fasting. Remember what we said? What you eat, how often you eat, what did it say? How much you eat, and the timing, right? Okay, so I can, and the studies show it. It shows that one of the best ways is to do the intermittent fasting.
And that will eliminate the fat.
Oh yeah, because this is what happens. The body says, I need food. I need energy. Here's some energy that I can use, and it's going to burn it. It's that simple. It's physiology. Right? That's one of the best ways to do it. And then when you do eat real food, whole food, wholesome food, and don't overeat. So, and Dr. Fung will say this, right? So because you're intermittent fasting, don't turn around and say, well, because I didn't eat for the last 18 hours, let me go and eat this whole bunch. Do you see? You don't want to do that. You want to eat just normally at the next two meals.
Well, Doc, listen, so you say eat normally.
Yes.
You say eat, don't overeat. What does that mean? I mean, what overeating in somebody's mind could be different. Right? So kind of talk to us about what does a well-balanced meal and not overeating look like?
Okay, so, and that's true. The amount of food is different for different people depending on what they're doing. And an elite athlete, they can eat a significant amount because they are an elite athlete and they are burning that off, and they need that energy, right, and they burn that off. But most of us are not elite athletes, right? So we've got to listen to our body's response to the food, right? Because the whole thing about eating, I mean, there's a whole thing around that. If you just shovel the food in and eat fast, you're not going to get the proper signal of satiety.
What is satiety?
Satiety means I've had enough.
So if I eat
Say,
too fast,
if you eat too fast, because it's all signaling, it's all signaling. When you start eating, the brain starts getting the signal. The dopamine gets released. This tastes so good, right? Right. The body's filling that need for energy, right? For nourishment. Okay. So that's why you can easily drink so much. If you're drinking juices and all that, you're getting all the calories, but you're not getting the satiety. Right? It's going right, because when you chew that food, that stimulates the signaling, right? So the brain says, oh, that's good, okay, and you're eating, then the brain says, that's enough, right? But if you're upset, right, going in there so fast, you miss all those signals, right?
Because the brain becomes confused.
It's because it doesn't have time. It doesn't get the time to process it, right? Okay. So now you just, and it looks good. So you're just going through and just eating, right? And the next minute you feel the discomfort in the abdomen, right? When you feel discomfort in the abdomen, you're past it, right? Yeah. So the key is to listen to the signals, recognize the signals. Have I eaten enough? Okay. And even if someone says, oh, well, now this is a pie I made here. But you say, well, I just ate it. Oh, no, you're not going to eat my pie. Right. Now you're going to force yourself past that signal. Do you see? Yeah. You're going to force yourself past the signal, right? Yeah. And especially eating late at night.
What's late, Doc?
What time are you supposed to be going to bed?
Well, what time we go to bed all varies.
Right.
So let's say I go to bed at midnight.
Well, midnight's too late, right? Because the whole signaling, right? The leptin, the satiety, when the way it goes to the brain.
You're talking about midnight's too late to go to sleep?
It's to go to sleep and even to eat. Right. It's the worst thing, because then this is what happens. You eat and then you're going to think you need more. Because now the leptin it becomes kind of resistant. Okay. So now you eat something, you think that, you eat, no, I'm not going to eat anymore. No, you're going to eat more because the leptin's now resistant, because it's past that time. The body's on cycles, it's on a rhythm.
Let's just say I go to bed at midnight.
Okay.
Then what time should I eat? When can I eat my last meal and be good?
Okay. First of all, you shouldn't be going to bed at midnight.
I got you, Doc.
Okay. All right. But so we need that interdigestive phase, right? So we want at least 4 hours before you go to bed.
4 hours. Right. So I need to be done by 8.
Right. But, okay, yeah. So that's that part. But we've got to shift it, though. Okay. We've got to shift it, right? Because you are now working against the rhythm. And when you work against the body's rhythm, it's only trouble.
Doc, what time should we be in bed then, Doc?
This is what I say to my patients, what I say to myself. Bed by 10, no later than 11.
Bed by 10,
no later than 11.
Y'all got that, everybody? Bed by 10, no later than. Weekends, I get to stay up a little later, right?
It should be the same whether you're on vacation or not. When I'm on vacation, I still aim to get up around about 5 o'clock. It doesn't matter that I'm on vacation. My rhythms don't change because I'm on vacation, right? So that's another fallacy that's put into our heads, right? Right. That's another fallacy. So whether you're on vacation or not on vacation, you keep the same rhythm.
Bed by 10, no later than 11, keep the same rhythm. Get up by 5. I got you. So listen, I got another question in the chat.
Okay.
Another question in the chat, and the question asks, how do you heal cold sores and canker sores?
Okay, so cold sores are from herpes virus. So, and they are actually in what we call the dorsal root ganglion. So they're always there. They come out under stress. You can always tell when that's going to happen, right? When there's a lot of stress, and especially if there's a physical irritation at the point where it comes out, right? And you'll see it will always come in the same place, okay? So the first thing is to deal with stress in the first place. Viruses like arginine. They like arginine.
What is arginine?
Okay, so this is where the whole thing about a plant-based diet can become a challenge, right? Because nuts are loaded with arginine. So if you've got cold sores, that's the time that you don't eat a bunch of nuts, right? And then that's when because what happens, it's a ratio of arginine to lysine. And when it gets tipped, and then in the setting of all being stressed, right, that virus just comes out. So you deal with the stress, you deal with reversing that ratio, and then you do all the things to help the immune system. You see?
So cold sores and canker sores are because of stress.
It's from the virus.
From the virus.
Right? But the virus is kept at bay in that dorsal root ganglion, right? And then when everything's all stressed and distressed, boom, you see it come out.
You're talking about dorsal root ganglion?
Yeah, it's in the nervous system. Sorry, it's in the nervous system, right?
I don't know what that is.
Right? In the nerves, it's in the nerves, near the spine. Okay, and they just stay there. They're just ready and waiting to come out, right? When the immune system goes down, they're out.
Okay. So I got another question for you. So let's talk very practically. COVID-19 is raging. We done had Delta variant.
Now we've got Omicron and Alpha variant.
We got Alpha variant. We got Omega variant. We got Omicron now. Right. So you got folk all over the strata. You got folk who say I'm vaccinated. I'm boosted. I'm good. And then I got other folk on the other side who say, I'm not touching that thing, and so forth and so on. But you talked about the whole importance about strengthening the immune system. If I take it from what I hear you saying, that if our immune system is working properly, then no matter what comes our way, we don't have all these underlying health issues, and our bodies are going to clear those things. So in a time like this, a pandemic like this, what are some things that you would suggest for either the vaccinated or unvaccinated that we can take to strengthen our immune system to ward off COVID-19?
Okay, well, first of all, I want to just clarify. Being the infection, SARS-CoV-2 with any of the variants, is just that. It's an infection. Okay. That is not COVID-19. COVID-19 comes as a result of an inflammatory, what we call a cytokine storm. The virus is gone by the time people die from that, right? So trying to kill the virus is not necessarily the answer, right? It's what the virus elicits, right? And once that train starts rolling, now you got to try and stop that hyperinflammation going on. And one of the lungs is a very sensitive area for that. Okay, and that's what happens. People get short of breath, and then their lungs shut down. That's usually what kills them, right, from this cytokine storm. So then what we have to say is, when you look at the people, the percentage of the people who go on to have bad outcomes from the infection and go on to full-blown COVID-19, there's a common denominator, and it's chronic inflammation. So when that virus comes into a setting of already chronic inflammation, now you can see what can happen here with this cytokine storm, right? Which is an inflammatory hyperimmune response. So my proposal, which I'm telling my patients, is you got to look and identify, do you have a source of chronic inflammation?
So what is chronic inflammation?
Okay,
like?
so
do I feel it? Do I feel achy?
Not necessarily.
Do I have headaches?
No, not necessarily.
I can be feeling good.
You can be feeling fine, except you could be overweight and have abdominal fat and have all kind of fat on you. There's going to be chronic. There's going to be inflammation there. You see what I'm saying, right? So there's acute inflammation. I don't want to give the impression that inflammation is bad. The body uses acute inflammation to get rid of stuff, right? If it sees a virus or this kind of stuff, it uses that acute inflammation process to do that. What we don't like is chronic inflammation. So what could cause that? A hidden tooth infection, root canal, chronic dental infection. That's going to give a chronic inflammatory state. We know about that. We know that in the context of heart disease. we know that heart disease is really about inflammation, right? And so they know that periodontal disease, dental inflammatory disease increases heart disease. We've known that for a fact, right? So hidden source of inflammation. Sedentary lifestyle is a source of chronic inflammation. Not being physically active. Who would have thought that? But we're a sedentary nation. Obesity causes because the fat is inflammatory. It's not just something that's cosmetic. It's highly inflammatory. That's why I got on my game, right? So I did not want to be in the high risk category, and I was in the high risk category. I was in that high risk category. I personally have not taken the vaccine because I'm not comfortable with the amount of research and the long-term effects. I'm personally not going to do it. So my personal responsibility is I needed to move myself out of the high risk category to moderate to mild. How do I do that? I'm doing intermittent fasting. The interdigestive phase, doing all that, eating real food, whole food, that kind of thing.
So
right?
the intermittent fasting drives down the chronic inflammation?
It drives it down indirectly because it gets rid of the abnormal fat,
which causes
which is chronic inflammation, right?
Okay.
Diabetes, chronic inflammation, metabolic syndrome, chronic inflammation. You see? So this is all those classic diseases, even dementia, chronic inflammation drives dementia. Chronic inflammation drives depression. Okay? So chronic inflammation is a real problem. And if you say, well, I want to protect myself, because even being vaccinated, just know that even though you're vaccinated, more of the vaccinated people are getting the variants. Because remember I talked about the innate immune system? That's not what's being invoked with this vaccine. It's the more targeted immune system. Therefore, because of that, because it's so specialized, it's not going to deal with this variant. It knows to deal with this thing right here. The innate immune system says, give me all that's coming, right? I'll take you, I'll take you, I'll take you, I'll take you. No matter what you look like, I'm getting you. That's the innate immune system. That is not what's been induced by this vaccine. Okay, so that's why those who are vaccinated, unfortunately, their immune system is somewhat dysregulated, so that they're innate now. So now that's why they're saying, well, first they're saying, get your vaccine and you're not going to need a mask. And then it's like, oh, wait a second. Or the vaccinated, they've got more of the Delta variant. Well, that was a no-brainer. We knew that was coming, right? And now it's just like, okay, everybody mask up. Yeah, put your mask back on again. Take them off, no, put them back on, right? Social distance, right? We all got. Now, we were looking at going to a cruise, right? Nice Christian cruise. We can't go now. Why? They said, not only do you have to show a negative COVID test, you've got to be vaccinated too. Well, how ridiculous is that? Either the vaccine works and you're comfortable with that and people can go, or you say you have a negative test. No, you've got to show a negative test and you've got to show that you're vaccinated. That makes no sense.
So the whole key, vaccinated, unvaccinated, need to work on strengthening the immune system and eliminate chronic inflammation. Exactly.
Look for your sources of chronic inflammation. If you're sitting around all day and not exercising,
chronic inflammation.
Get up and start moving. If you're eating junk food, processed food, all this kind of stuff, you're not giving the nutrients for the immune system.
Chronic inflammation.
If you're not sleeping,
chronic inflammation. How many hours do we need to sleep every night, Doc?
You know, it's different for different people as they get older, right? The younger you are, the more you need.
Yeah.
Right? I can get away with 6 hours. They say 7 hours. Here's the key, if you know if you're sleeping well. You go to sleep when you're tired.
Yeah.
You wake up without an alarm clock. And when you wake up, you are rested. You don't have to take a nap in the day. You feel good until it's time to go to bed and you're tired. If you've got to wake up with an alarm clock, you've got a problem. And if when that alarm clock goes off, you hit snooze, you've got even more of a problem.
Dr. Medlin. You met them. So this is some serious stuff. We were having a conversation, and we were talking a little bit about about dandelion.
Yes.
Can you talk to us a little bit about
that? Was interesting. Yes, that just came out. Actually, it didn't just come out. I just came across that study looking at dandelion leaves and how, because with the spike protein, part of its mechanism of action is that it affects the ACE2 receptor, okay, and that contributes to the demise. So what we want to do is interrupt that, and the not dandelion root, but dandelion leaves.
Them yellow things.
Those yellow things.
They
Exactly.
They grow in your yard.
That's right.
And
That's
make
right.
Your yard look ugly.
That you think that they're weeds and you want to spray them and get rid of them.
Right.
Right. Okay. Dandelion leaves. So you find a good, and if you sign up on my website, I send regularly out e-blasts about different health topics and pertinent health topics. And I just sent one out. And if you want that, you can email into my office or to the website and say, please send me that latest e-blast about what we need to do.
And what's that? What give us that?
So my website is drsalter it's drsalter.com. Yeah.
drsalter.com. Dr. Salter, drsalter.com.
That's right, .com, exactly. And I like to send out pertinent information, sometimes so simple, even using iodine, an iodine spray. And I put that in there. Iodine will kill viruses in the nasal passage. So this is what I said, this is the plan. When at the beginning of the day, you get ready to go out, like Scott and I did, we took our spray of iodine, one spray to each nostril. That will kill not only SARS-CoV-2, but other viruses for 8 hours. Now, when you're out and about, and this is not just about SARS-CoV-2, this is just normal stuff. You know, you don't want to get any of the viruses from people, right? So when you come back home, do the saline rinsing, right? And then you can get the from Walgreens or Walmart's the iodine oral rinse, gargle that, okay? And in my news blast, I give you the research that goes along with it. So you gargle that. So if anything, because you go to get exposed, you know, I'm always surprised when people said, well, I don't know how I got it. What do you mean that you don't know how you got it? It's a virus. Of course you're going to get it, right? Everyone's going to get exposed to it. It's not that you're not going to get it. The question is, what's your body going to do when it sees it, right? Okay. So, but if you want to decrease the load, the viral load and transmission, rinse with the hypertonic saline. Do the oral gargling, and then you do all the stuff for your immune system, get your sleep and all those things, right?
That's a lot of stuff, Doc.
It's very simple. You get a spray. You go out and about, you come back in again, spray, rinse, spit it out. Now, what's hard about that, Pastor?
So where am I getting this iodine spray from?
Go to the
website.
Go on the website, right? And I tell you exactly. I tell you where to get it.
Yeah. Okay.
So the research behind it.
Yeah.
It's simple.
Yeah.
This is more effective than you walk around in the mask on.
But listen, Doc. Listen, Doc. So here's my thing. So I watch the news. I'm watching CDC.
Oh yeah.
I'm listening to the FDA.
Oh yeah.
I'm listening to doctors. Ain't nobody saying none of this stuff. They're saying I gotta get. They're saying that if I get the vaccine, I'm good. But you're telling me I need to be worried about my immune system and chronic inflammation and all of that. Why don't I hear that from my doctor?
Okay. That's a very good question. The CDC very quietly said, hey, folks, obese people have a harder time with COVID. You doctors ought to be talking to them about that. Did you hear it on the airways? No, it was mentioned. It's not out there, right? Because we are a nation, we want a one-shot this. We want that silver bullet. We want to keep on doing what we want to do, and then you'll say, give me a pill to fix it. Give me a shot to fix it. I've seen those patients. We all feel, we'd like to say, oh, I want to lose weight, I want to do this. Okay, what's that one thing I can do, right? There's not one thing. It's a comprehensive thing, right? It's a comprehensive thing, right? There's not a one. So when you have that shot and then think I can go and drink juice, not exercise, eat, guess what? You're going to get it again. and it may be worse the next time.
Doc, you keep talking about juice.
Got to take the juice.
Oh man.
Now let me help you out here. The way to wean off the juice is to turn it into juicy water. I used to do that for my children.
Juicy water.
Juicy waters. This is what you do. Here's your glass that you normally drink. How much juice do you normally drink, Pastor?
Let's not talk
At
about
one
it.
time. Come on, Pastor. It's all right.
Let's say a glass.
A glass,
Okay.
8 ounces. Okay, so this is how you're going to wean yourself.
Mhm.
You're going to put 1 ounce of juice,
1 ounce of juice.
and then you're going to fill it with water. You can even add sparkling water.
That don't.
Yeah, sparkling water with a little bit of juice. Now you dilute that hugely. That impact on your insulin and all that, it's going to be dramatically diminished.
So the problem with drinking the juice, the high amount of sugar,
Correct.
that is going to spike my insulin.
Exactly.
Okay, so if I'm not diabetic, why do I care if my insulin is spiked every now and again?
Now, if you're telling me that you're drinking juice once in a blue moon,
Yeah.
I'm not going to say anything.
Okay.
If you tell me, Dr. Salter, the last time I drank juice was 9 months ago, and I may drink some more tomorrow, I'm not going to worry about that. Now, if you tell me the last time I drank juice was yesterday, I'm going to drink some more today and tomorrow and the next day, then I'm going to have a problem with that. Going to have a problem. No, I'm not going to have a problem. You're going to have the problem.
I'm going to have a problem.
Okay.
Mercy, mercy, doc. Mercy, doc. Okay, listen. So I got some more questions for you.
Okay.
I tell you what, we're gonna take this 18 minutes up to the 6 o'clock hour. That'll take us to 2 hours. We will go no longer than that. People are loving it. So I got several questions here. How many ounces of clean water should we drink daily?
Okay, now that's going to be individualized, right?
Individualized.
It's weight-based. And when we want to talk about hydration, right? Water is great, but water can kill you.
Okay.
If you drink too much water, you can get hyponatremic, seize, and die, right? So more is not always best. We got to look at your weight.
Okay. So let me give you myself.
Okay.
So I weigh 170 pounds.
What's half of 170 pounds?
Man, why are you making me do math on this?
It's 85.
85.
Okay. So you need 85 ounces of hydrating fluid. So that would be water, herbal tea, even watermelon. That's very water-based, right? So, even if you're doing soup, right? You see?
Yes.
Okay. Yes. So you look at the entirety of it. Okay. And so half your body weight up to 100 ounces, right? So once you hit 100 ounces, you don't have to go past that with the water, because then you can go into the hyponatremic and all that. Okay. So hydrate. Water is huge, right? When it's done properly, arthritis, cough, right? The first thing, like if you're coming down with something, you drink that water, hydrate the membranes, because look, the viruses like to attach to dry membranes.
Wait a minute now. So you were talking about arthritis. Oh
yeah.
Let me guess. Arthritis is the result of chronic inflammation?
Absolutely. And if you drink water, watch a lot of that pain go down.
So if you have arthritis and you drink more water, the pain will reduce.
That's what I've seen, right? Okay, because arthritis is inflammation, it's irritation, right? And the connective tissue requires hydration. It requires hydration.
So it's not arthritis doesn't come from cold air and bones and sitting on the air conditioner. These are the things that we've heard about. No, it's chronic inflammation.
Chronic inflammation.
Mercy.
Okay, and the foods we eat, being inactive.
Yeah.
Okay.
Yeah, being inactive. Okay, I got you. All right. Next question. Oh, I've got someone here that wants your contact for your clinic. So
that is on the website.
That's on the website. We're going to drop that in the chat, everybody. That's going to be, you can go to drsalter.com, and which I just dropped in the YouTube chat, and you can be able to find her. All right. Next question. Phyllis Garnett asks, what's the best grape juice to drink to help with intestinal nutrients?
Grape juice?
Yes.
We don't drink grape juice.
We don't drink grape juice.
Eat the grapes.
Eat the grapes.
Get the organic grapes and eat the grapes. Don't do the juice.
Don't do the juice.
Remember, I only told you about doing 1 ounce of juice because I wanted to wean you off it.
But we thought that was like the juice that was like 8% juice. What about the 100% juice, Doc?
It's 100% juice with 100% no fiber. It's going to hit the insulin. Now, okay, is there good, better, and best? My mother used to always say good, better, and best.
Yeah.
Right? There's no best, right? There's probably no good in this. But you see those cocktails?
Yeah.
Look at that. You'll see juice.
Yeah.
You'll see sugar.
Yeah.
You'll see fructose.
Fructose.
It's a metabolic disruptor. It's the worst thing, run in the opposite direction.
Like that high fructose.
Like that high fructose corn syrup. You see that grape cocktail that looks so nice?
Yeah.
Okay.
Yeah.
That's a problem. So now there is an organic grape juice where it is just pure grape juice. But even then, it's still good. If you have the choice, like if someone had a gun to your head and said, you have to drink juice. You've got a gun to your head.
I'm drinking juice.
Okay, right. And you say, well, give me this one doesn't have high fructose corn syrup and doesn't have any added sugar, and it's just the grape juice. If you force me, if you're going to kill me, unless I drink the juice, I'll take this one. That's the way you're going to do it, right?
So we need to stay away from corn syrup and fructose.
All high fructose corn syrup, all that stuff,
all
right?
that stuff, because those are disruptors.
The metabolic disruptors and cause the chronic inflammation.
Causes the chronic inflammation.
It's cheap to make that stuff. This is big food, right? They're making cheap stuff so cheap. Look at those ingredients. When you think when you kind of go, oh, this is so nice, it's so cheap, right? It's junk. That's why it's so cheap.
Okay. Next question. How can I dissolve calcium buildup?
That's a big question. Now you're asking something specific, and of course it depends on where it is in that whole thing. Very often calcium will build up because the body is chronically acidic. Okay, chronically acidic. So I'm not going to speak to anything specific. Again, proper hydration and eating a nice alkaline diet from vegetables and fruit is going to make that flip. Osteoporosis is considered a metabolic disease. Most people say, oh, you have not enough calcium left. It's a metabolic disease. It's a disease of acidosis. Calcium is put in the wrong place. It's taken out of the bones and put in other places, right? We need a plant-based diet. That is classically seen in osteoporosis. So while I'm not saying anything specific, because I don't know what's going on, but the whole calcium disruption is kind of complex. Out of the bones, into the vasculature, into the joints. We've got to check. Just putting someone on a good plant-based diet with proper hydration and physical activity, you'll unleash things of the body for the body to start taking care of business.
So what should I eat to get rid of floaters in the eyes?
Floaters in the eyes, again, remember we said cells, tissues, right? It's all the same stuff, right? It's not what you should eat. It's it's giving the body what it needs, and the body will take care of the issues, right? Eat a plant-based diet, give the body hydration, get the sleep, do all those things that will allow the body to say, let me start taking care of this thing that's floating around. Mm-hmm. Don't eat all day, right? Allow the body to go into the autophagy. Get the sleep so the body can turn its attention and say, oh, those are not supposed to be there. Let me recycle those out of there, right? We want to get out of the mentality, even in the natural realm. Okay, what supplement can I take for this? That's the same as saying, what medicine should I take for this, right? It's the same thinking. We've got to get away from that. What little thing can I take, right? It's even if I talk about dandelion and I talk about these other things, it's still in the setting of eating and living the proper lifestyle. Mm-hmm. Those stuff are just icing on the cake. The cake is the lifestyle.
I got you.
Okay.
Just a shout out to my boy, Jason Forte, who says, I only drink water and I eat for fuel. Not for taste.
Come on, there.
All right, this is a good one right here. Jean Brown asked, how would a person working 12-hour night shifts incorporate these principles?
You know, and that's an excellent question, and it is a challenge. The night shift workers, unfortunately, it is a challenge. We cannot beat physiology. We are not designed to work at night. And I had to do it as a resident physician. It was the worst thing. My metabolic disruption became the worst. I'd work, you know, my longest was I think a 32-hour shift, okay, of no sleep. It's metabolically disrupting. It is, and it's very hard to do. And so it's hard on the system, unfortunately. And so if you are a night worker, and there are a lot of night workers, and we need night workers, you know, emergency rooms, hospitals, right? But the thing is not to flip, right? If you're going to do it so the body gets into that rhythm. And then you have to then check to see, do I have marks of chronic inflammation? Do I have marks of metabolic disruption? Then you're basically just flipping things around and monitoring to make sure that you're not, going the wrong direction.
Yeah.
But it is going against the rhythm. That is the fact.
Yeah.
You see.
Yeah.
So, and the question is, how well can it be mitigated?
Wow. This is amazing. We are getting so much information. Can we do this again? And King, absolutely, we will do this again. Now, one last question. So this, you kind of spoke to this, but person asked, what type of supplements would you recommend? So we need to be eating, the right type of foods, how much, have the right portions, all those type of things, eating the right things, getting rid of the garbage out of our diets. Got that? All right. So do we need supplements?
It depends.
It depends.
Right. I know for sure the one supplement is vitamin D. Okay. For sure.
Everybody needs that.
The majority of people say, you know what? I stopped taking my vitamin D because I went down to Florida for a few months. Okay. I'll just check your levels. Low. Right. Most people are low. And part of it is with the change in the angle of the earth and the covering, right, of the rays not getting through the way they're supposed to do things properly so that we're getting it in the skin, you see? So most people, and I check everybody gets that check, okay, to see where's their level. Is it optimal or is it not optimal?
Now, what's optimal?
So there's normal and there's optimal, okay? Normal is above 30. Let's say 30 to 80.
Yeah.
Optimal, we drive from 60 to 80, no more than 100. Okay. So I like to get people in 60, 70, 80 range, get them in there so nicely, right? And then it's great.
So it's optimal that we need to be sure.
Right.
Because a lot of times when if you have your cup, you have your physical, if you're within the 30 range, they'll say that's normal.
They say that's normal, right? But we don't see. Here's the thing. It's normal for most Americans to die from heart disease. Do you want to be normal?
No.
Okay.
I want to be optimal.
Thank you.
Come on, throw that in the chat. I want to be. Doc, you gave me a word. I want to be optimal. So tell me, just you talked about vitamin D level being right. So last word on this, what's so crucial?
So vitamin D is important, but there are vitamin D receptors all over the body. All over the body. So it's not just the bones. It's important for the heart. It's important for the immune system. It's important for the kidneys. It really shouldn't be called a vitamin, right? In the truest sense of the word. Okay. This is more than a vitamin. This is a signal molecule. It's a major signaler. Okay. So it's important that we do have those levels well. But even if the levels are normal, then you've got to say, well, are the membranes good to accept the signal? And where does that come from? That comes from the type of fats that we eat. If we eat all the junky foods and all this kind of stuff, then even your membranes are not good, right? Do you see? So there's more to this. But you know what? It sounds like it's complex. But if we went back to first principles, eat food in as near natural state as possible. That's minimally processed. If we go back to basics first principle, we don't have to go doing all this little stuff and all these gyrations, right? Drink hydrating fluid. Don't do the processed stuff, right? eat the whole stuff, get your rest, get your relaxation, move your body, deal with stress. The body will take care of the rest of it, right? The body will take care of that. It will.
So if the body is running at optimum, and all the stuff that we fear from all of these diseases that we've talked about reduces significantly.
Significant reduction. When I first came to this country, I spent a year at UT Pines as a staff physician. And that was such an eye-opener for me. I mean, we had people come, could barely walk from here to there. They were not given all these major medicines. There were no cardiac interventions.
Carjacking intervention.
No, there was none of that, right? It was a change in the lifestyle. It was getting the sleep. It was getting the nutrients. I used to walk every day out in the country, right? Multiple times a day. And I saw these people change from can't breathe properly, chest pain when I walk a few distance, walking the entire thing, now walking 3 miles a day, lose the weight. Lifestyle is powerful. That is the strongest medicine you could have. There's not a supplement I could give to you to say that's going to supersede lifestyle. There's not a medicine that I'm going to give to you that's going to supersede lifestyle. Lifestyle is the key. And the sooner we figure that out, the better it will be.
Powerful. It's been wonderful.
Thank you. I'm glad you enjoyed it.
Hey, we're going to bring, you coming back?
You've got to invite me back.
You already invited back. Listen, if you all want to hear more of Dr. Salter, my health ministries leader, has just said, awesome. It's been an awesome, awesome time. We want to thank you for spending some time with us, and glad that you were with us, and Scott was able to come along as well. It's just been a tremendous experience. I think our eyes have been open. My takeaway, and my wife is always preaching to me, but my takeaway is we got to work this thing through lifestyle and not be dependent upon, prescriptions and so forth. We're not telling people, like Dr. Salter said, don't go and throw all your stuff out tonight. Don't do that. Talk to your physician. But lifestyle to having life more abundant is the key. That's the key. So as we close out the year and we get ready for these New Year's resolutions, that's it. Greater health. That means I got to start tonight. I got to throw away my juice tonight. Go to bed by 10, no later than 11.
And then you're going to get up without an alarm clock.
Without alarm clock.
You're going to sleep naturally and get up without that alarm clock.
Mercy.
You're going to take the stairs.
Mercy.
All right.
Jason has already been looking for me to do this. He said, brother, I need to join him at 4. Amen. Doctor,
Amen.
Would you pray for us to close?
Absolutely. Heavenly Father, we're so thankful that we can come into your presence in the name of Jesus. Father, we're just thankful that we are fearfully and wonderfully made. We're thankful that you've designed us to heal if we give the body the right circumstances. And so we just pray now for all those out there listening. We're all on a different journey, but we know that through your grace and through your mercy that we can do all things through Christ who will strengthen us. There is nothing that we cannot do with your power and your grace. And so I pray for each one that as they step by step choose one thing, choose 2 things that they'll be able to implement to make a difference in their health. And in so doing, Lord, that they'll be able to communicate more clearly and more effectively with you, with clarity as your Holy Spirit speaks to us, so that we can be doing the right things you'd have us to do in these last days. So we're thankful that you do hear our prayers, that you will answer according to your will. We pray that you bless this Linwood Seventh Adventist Church and the leadership here. It was just so excellent, Lord, to see what all that they're doing. We just pray that they will be a lighthouse, a light in this community, in one of your instruments. We pray in the name of Jesus and for his sake. Amen.
Amen. Listen, if you were blessed by what we did here tonight, you know what we need you to do. We need you to like, we need you to subscribe to our channel. So YouTube right there, if you're not a subscriber, go ahead and hit that subscribe button right now, and then turn on the reminder. So every time we go live, you'll hear about it. Hit like on YouTube if you're watching on Facebook, and then we want you to share this information to your page. This right here, I think most of what we do is literally life and death. Life and death. And we want you to choose life. And what's the text, 3 John 2? Above all,
I wish with all things that you will prosper and be in health, even as your soul prospers.
that's it, folks. So on that note, we're going to take you home with some music. God bless you, everybody. Thank you so much for joining us for Your Health Matters.